Mr. Andrews.
Thank you, Mr. Chairman. I agree with you that well prepared, did a very nice job today. We appreciate all four of you. Ms. Turner, my understanding of the word freeze is that things stay the same, numbers don't change. So if there's a freeze in a number, it doesn't change. You say on page 3 of your testimony that when the health care law was signed into law in late March of 2010, a hiring freeze began in the country. Are there more private sector jobs today or fewer than there were in March of 2010?
It's sort of a term of art, hiring freeze, and essentially so you begin to see the trend in hiring going in a much different direction.
It's a term of art? How would you define the term freeze?
Well, the term freeze would basically mean no new jobs. But when you talk about 6,000 new jobs in a month in an economy that needs 14,000 new jobs in order to begin to get people back to work, that hardly seems to be
Well, I think most people would agree with your definition of no new jobs. But of course, the facts are from the Bureau of Labor Statistics that in March of 2010, when the law was signed, the economy had 106,916,000 private sector jobs. And in September of 2011, the last month for which there are data, it had 109,349,000 jobs. So that's an increase of 2.433 million private sector jobs. Is that a freeze?
But when you have to also account the new workers that have entered the workforce, and when you account for new workers...
I understand that. That's about the percentage and the rate. Is it a freeze?
Well, you have to look at it in terms of the number of jobs that are required to move the unemployment rate, and the fact that the unemployment rate has been stuck at 9.1% shows that we're not creating enough new jobs to even keep pace with the new workers that are entering the workforce.
But you would admit that there are 2.4 million new private sector jobs since the health care law was signed.
But there are also at least that many new workers that entered the workforce.
But is it yes or no?
There are new workers entering the workforce, but not enough to account for the people.
I understand. Let me ask you this. You make the comment that this, there's good reason to believe that the health care law is a major contributor to the hiring halt. That's the halt that added 2.4 million new jobs. So on what basis do you believe there's good reason to believe that the health care law has led to this hiring halt?
This was a study done by James Shirk at the Heritage Foundation looking at hiring patterns between the beginning of the Obama administration and the point that the Affordable Care Act was enacted, and then from then until 15 months later when the study was done. There was an increase in about 67,000 jobs, net private sector jobs a month being created before the Affordable Care Act was enacted.
Well,
and after that, only 6,500 a month.
I know, I read your testimony. I know that you said that. How would you respond to the Wall Street Journal's July survey of business economists? And I'm quoting, "The main reason the U.S. companies are reluctant to step up hiring is scant demand, rather than uncertainty over government policies, according to a majority of economists." Are they wrong?
There's a faltering economy. People don't have money, many of them because they don't have jobs. It's a very cyclical effect.
I absolutely agree. Would more people have jobs if we hired construction workers to build roads and bridges?
Absolutely, but pushing
Would more people have jobs if small businesses got a tax cut when they hired people?
Absolutely, as long as we're not pushing that onto taxpayers.
Would more people have jobs if we didn't have a $1,500 tax increase on middle-class families on January 1st?
As long as it's not being pushed on to future taxpayers.
Would more people have jobs if we stopped the layoffs of police officers and teachers?
As long as we're not pushing the cost onto future taxpayers.
Under the health care law, if a business has 50 or fewer full-time employees, what do they have to do?
They don't have to provide health insurance.
They don't have to do anything, do they?
Well, there are certainly many other regulations they must comply with.
No, but under the health care law, is there anything a business with fewer than 50 or more full-time employees has to do?
No, but each one of the individuals in that business must have health insurance. So even though the employer may not provide it.
The topic here is in employers' ads. So if you have fewer than 50 people, you don't have to do anything, right?
As far as mandatory health insurance, no, but that's on the employer. It still is on the individual employees to have health insurance.
I fully understand that. Thank you, Mr. Chairman.